Dr. Allen.
Thank you very much. And it's truly a pleasure to be here. And I thank Mr. Spaulding for the invitation, and Mr. Lopes and the people at the East Boston Neighborhood Health Center for hosting us this afternoon. I am Alan Woolf, and I co-direct the Pediatric Environmental Health Specialty Unit, the Region 1 PESU as it's called, which represents New England. We're based at Children's Hospital in Boston as well as Cambridge Hospital, and we work very closely with our partners in Region 1 EPA as well as the APSDR and the Massachusetts Department of Public Health and the Department of Environmental Protection and the other public agencies. This is a momentous day for all of us in terms of the public's health, and so we celebrate this accomplishment. You all are the champions of advocacy groups, of public health policy groups, and those that are interested in the health and welfare of the population, not only in Boston but in all of Massachusetts. And what I want to do is take a minute and tell you about the clinical side of the issue. And that is, we run a clinic twice a week called the Pediatric Environmental Health Center. And we see families who are impacted by the adverse effects of the environment on their children's health. That's what we're about. One of those impacts, one of those toxins, is mercury. And it's a known neurotoxin. It is, in chronic overdoses, a real threat to humans who are exposed to it over time. It's especially a threat to vulnerable populations, such as infants and growing children, pregnant and lactating women, their fetuses, their newborns, and young breastfeeding infants. Mercury is associated with long-lasting and potentially irreversible effects on the brain and the nervous system, and these effects can reduce a child's intelligence, can change their behaviors, can cause seizures, muscle weakness, paralysis, and other neurologic injury, and impair their overall development, limiting their future as productive citizens. In fact, mercury has injurious effects on individuals of all ages, and as Mr. Spaulding pointed out, causing not only damage to the brain and nervous system, but also the lungs, the kidneys, and the blood. In severe cases of poisoning, it can impair hearing and speech, it can affect your vision, it can cause paralysis and coma, and even death. There are horrible environmental disasters involving mercury in the past, and we would never want to revisit those times. And that's why it's so important that we try to remove all sorts of background exposures to mercury as well as we can. As Mr. Spaulding said, these new regulations will prevent countless premature deaths, cases of chronic bronchitis, non-fatal heart attacks, hospital and emergency room visits, acute bronchitis and other respiratory symptoms, and thousands of days of lost productivity where people have to miss work or miss school or miss daycare because of their illnesses that are brought on by toxic air pollutants. Thus, as a state and indeed as a nation, we've embarked on a long road to try to either minimize or eliminate all preventable exposures to environmental contaminants such as mercury, known contaminants. It's in some of the fish we eat, it can contaminate soils or homes from a variety of products, and it's harmful if it's in the air. And so that's why these new standards are so important. That's why all of you who are involved in this legislation and pushing this stone a little bit farther forward are champions in public health and public policy. It's in all of our interests to reduce to the most reasonable extent possible all background sources and exposures to all forms of mercury. And on behalf of my colleagues and staff in the Pediatric Environmental Health Specialty Unit at Children's Hospital and Cambridge Hospital and elsewhere, let me offer our congratulations to you and our support of these tremendously important new regulations and the agencies responsible for them that have headed us in the right direction. Thank you very much.